Now, it's really common to see insomnia if someone's dealing with a severe catabolic imbalance because at the cellular level, their body is awake kind of most of the time. So they could even take some sleep aid to knock them out in the head and get some sleep, but their body is pretty much awake the whole night. So they'll wake up kind of exhausted, like their body didn't really get any sleep, or maybe they'll feel okay and they'll be tired 2 hours later. So it's really common to see this with this imbalance because the body is not moving into its rest and repair anabolic mode. Now, a catabolic imbalance is not the only cause of insomnia, so if you're dealing with insomnia, don't just assume you have a catabolic imbalance. We really like to see people look at their own body chemistry to figure out if they're leaning too far on that catabolic side. Another issue that's really common to see if someone's overly catabolic is a loose stools or chronic diarrhea type issues. Now, there are other causes of chronic diarrhea for sure, but in an overly catabolic state, the body will send more of our water to the bowels and less to the kidneys. So with all the water going to the bowels, it can really loosen up the stool and create that chronic loose stool issue. Now, if someone's stuck in an overly anabolic state, they can sometimes deal with constipation because the body's not sending enough water to the bowels and that bowel's getting dry and hard. It's also very common to see insulin resistance with someone who's dealing with a catabolic imbalance. For one reason or another, the insulin doesn't seem to be as effective in this overly catabolic state. So when the insulin goes up to try to sweep all the glucose out of the bloodstream and it's not really getting it all out, the body will like, oh, well, I'll just make some more insulin. And the body will make more and more insulin to do the same job that a smaller amount of insulin should have done. So with this high level of insulin all day long, every day, eventually the cells stop listening to it and the person will become insulin resistant. This high level of insulin not only blocks the body from burning stored fat, it also tells the body to store more as fat. So we see a lot of people with weight gain issues with this overly catabolic state and leaning toward this insulin resistance issue. Most of the type 2 diabetics clients that we see seem to be very overly catabolic in this manner. So in a lot of cases, when you can help someone correct this catabolic imbalance, you can help their insulin work a little more efficiently and eventually improve that insulin resistance.